Hello class, my name is Tonia Andaluz, and today we are going to talk about ABC Hospital and their possibilities of enhancing their current information technology system to utilize electronic health records. I am the current manager of the Nashville campus for ABC Hospitals. The Nashville campus is nestled in the middle of downtown Nashville, Tennessee, where according to the United States Census Bureau, our population is currently just over about 660,000 residents. Of those residents, ABC Hospital, the Nashville campus, has serviced and provided care to about 1.5 million patients. Of those patients that spent 24 hours with us, ABC Hospital received on average $400 per 24-hour hospital stay. Now, as the manager of the Nashville campus, I recognize that our goal is to increase revenue, and I strongly believe we can do this by incorporating an electronic health record system over moving the facility or enhancing the facility. Right now, some of our most top consumer concerns are frustration surrounding paper records, meaning needing to have duplicate tests done because paper records are not available, having to obtain personal records as the patient on their own, and then going and providing these records to their individual providers with their individual specialties. Consumers feel that there's poor follow-up communication between the consumer and the providers, as well as poor follow-up post-discharge communication that results in higher readmission rates. Consumers feel that the departments within the hospital do not communicate properly, and also that we are also often short of supplies. So electronic health records can also help us with our supply chain as well, which is certainly a concern for our consumers. What exactly is an EHR or an electronic health record? It is an electronic medical record that many providers or any provider on a patient's healthcare team can add information or data into this record, and it is easily seen and transparent to anybody who is on that patient's healthcare team. So an EHR's main function is for the collection of consumer health data, and the Affordable Care Act or the ACA mandates that data that is collected is easily transferable between the patient's healthcare team. That means any provider, any specialty, and including the patient, so that there are no delays in service and to improve quality. Those duplicate tests that we talked about in a previous slide, a lot of times those need to be done because the paper records are not easily transferable or transparent. So incorporating an EHR, which is all electronic, allows providers on the patient's healthcare team to be able to work more closely and to communicate more, creating better outcomes for that patient. As previously stated, electronics health records have had much success in improving quality within hospitals. Again, it decreases the need for duplicate tests because tests are almost immediately readily available for any provider who has access to be able to view those results, as well as being able to send those results to other specialty providers within the patient's healthcare team, which also mitigates the need for duplicate tests when the test is used to look at different various organs. The information that is received is easily transferable between the healthcare team, which helps, again, reduce those duplicate tests. It has a lot to do with increasing the not just communication, but meaningful use of communication and information, where this information is taken in by professionals such as PCPs, nurses, and doctors, and they're able to take that information and incorporate it with their knowledge and help to increase healthcare outcomes may be able to meaningfully use this information that comes in the electronic health records. The use of electronic health records or health information technology period helps to increase productivity because we are not pushing so much paper around, and it's easier to transfer this information, meaning less administrative time and increased administrative efficiency, which means more is getting done in a less amount of time, saving money there. There have been quite a few experiments throughout the United States where it shows how health information technology has helped to increase revenues throughout the United States by increasing administrative efficiency as well as increasing productivity. In our current stage, I think it is wise that we invest in an EHR system versus any other enhancements that we may do.